So we just left off with me arriving in the waiting room. I'm back and I'm ready to talk about more. And also thank you to everyone who's being positive about this story, because I'm also sharing it on other platforms, including Facebook. And Facebook, they are ripping me apart and telling me it's my fault that this happened, so that's fine. Nobody's going to have more guilt and shame about this than I do, so you can't say anything to hurt me that I haven't already thought myself about what I went through. I'm very well aware that I should have gone to the hospital sooner, in hindsight. But if you're not in my position and you weren't in my situation, you don't understand what I was thinking. Moving on. When I got into the emergency room, I was parked closest to the doors of where you would walk in. To my other side, security offices, all the hallways that you would go down if you were being admitted. Also, the bathrooms are down there, and that's going to be important. Like I have said, I have been to this hospital before many times for family members. I also know how emergency rooms work. I know that people are seeking pain pills and all. I know how, I'm not dumb. I know how it works. I went there for help. I was in so much pain and I didn't understand what was happening, and I was dying. I didn't know that I was dying. And if any of the naysayers want to come for me for that, you can talk to the gynecologist and all the doctors that I was speaking to who told me you have no idea how close you were to death when you came in. The infection, I'm going to put the word below because I don't know how to pronounce it, choriamniosis. Basically, it was an infection with my amniotic fluid and my liver, and it was because of the pregnancy. So I was emitting this kind of very foul smell whenever I was soiling myself, which was happening frequently because I was left alone in the emergency room for so many hours. Someone came very soon after I was put in there to take my vitals and hook me up to like an EKG machine and check my heart. I was in sinus tachycardia, and I know that people can get that just from being my size and walking around a room, but this was extreme. Where this story starts to get uncomfortable for me is because of the fact that I know that in normal circumstances, you don't give someone who comes into the ER water and that there's going to be a wait. But I was not a normal situation. I was having contractions that were maybe 2-3 minutes apart at one point before it got worse and worse. And I would be gripping onto the wheelchair that they put me in, and I would just be bearing down and screaming. And as I'm doing that, of course, I'm soiling myself. And at one point, I remember I looked up to the other side of the room, and every other patient in the ER was on the other side of the room. Nobody could take the screaming or the smell, to be honest, that was coming from me. And I would ask for water probably every